Until recently, most efforts to target the VHL pathway in patients with find effective therapies for patients with VHL relied on targeting proteins and molecules that are well downstream from HIF-2α. And those were met with limited success, but those molecules and those compounds also had enough toxicity that even though they were very successful in patients with sporadic forms of clear cell kidney cancer, they met with limited buy-in from patients with VHL because the toxicities, as I said, need to be really mild for this group of patients to accept it, and that was not the case with some of these agents. So in many ways, HIF-2α is the perfect target, right? So we were really waiting for the development of a drug that could directly target HIF-2, which is much more upstream in the VHL HIF pathway that leads to these tumors. So in many ways, at least in our minds, HIF-2 was an ideal target. Obviously, not every single patient we put on the study responded, and not everybody stayed in response. I told you already that several patients had shown some evidence of progression. So there is more to be done. And what's the best way to find other targets? I can't tell you at this point that we have another magic target that we can go after. I think it's going to be more a question of going back to the lab and trying to understand in this setting of HIF-2 inhibition, what other molecules do we need to effectively target in order to both improve the response rates and the durability of these responses and minimize the chances that patients develop resistance, as we're starting to see at least in a few patients. Keep in mind that as we try to achieve all this, we also need to come up with targets inhibiting which pharmacologically would not come at a prohibitive cost in terms of side effects. So it's a challenge, and it's a challenge that I think we need to take back to the preclinical setting and try to come up with answers to. So yes, clearly there are other targets we should go after. What the best next target is, I think remains to be elucidated at this point.